Well, hi everybody. Yes, it's absolutely true. What the world needs now more than ever, is love, sweet love. Well, I'm Beatty Convertos, and welcome again, my friends, to the Ask Beatty show. And I can hardly believe that this is going into my 13th year of hosting the weekly Ask Beatty show. And as you know, I am a psychotherapist. I'm also a sex therapist and an author and an advice columnist. And I've been in the national and local media for many, many years. And one of the things that I really love hosting about this show is that I hope every single week, and I hope that this does not sound egotistical or narcissistic, but I do hope that there is some little thing that I can communicate to you where you have perhaps an aha moment that can really make your day, can really make your life better. Because the show is really about empowerment. I mean, if we're really honest, everybody, there are no exceptions, whether you're rich or poor or black or white or Hispanic or gay or straight or bi or Christian or Jewish or Muslim. The fact is that we all go through so many ups and downs in our life. And again, nobody gets a pass. So that on this show, we talk about mental health, and we talk about a lot about relationships and sexuality. But more importantly, it's not just the content of the show that is important. You know, what I hope every single week is that somehow that I am able to motivate and inspire you to be willing to acknowledge and address and resolve the issues that may be really playing havoc with your life and your relationships. And, you know, one of the things that I do hope that I have convinced you over the years is that we don't need to navigate the ups and downs of life on our own. And that oftentimes, I mean, you can have family support and friends support, but sometimes the very best thing that you can do is reach out and find yourself a good therapist. And of course, that is always a challenge, whether or not you are assessing who's right for you and who's wrong for you in your romantic relationships and personal relationships. When it comes to doctors and lawyers and therapists, we really do have to be very careful who we let into our lives. Well, I don't know how many of you are aware, but May is actually uh, Mental Health Awareness Month. And, you know, I was doing a little research about this and I was wondering, you know, how did this start and who thought about starting it? Well, interestingly, it was President Joe Biden, and he proclaimed May 2023 as National Mental Health Awareness Month, honoring and the courage of tens of millions of Americans living with a variety of mental health conditions and joining. And I think this is so great that he really began this initiative with the hundreds of millions of people around the world who recognize World Mental Health Day, actually on October the 10th of every year. So the theme developed by the World Foundation of Mental Health is a game-changing breakthrough, and it is mental health. And just think about this. Mental health is a universal right. And celebrating and acknowledging these days is an important first step, I believe, in encouraging discussions, and hopefully lots and lots of discussions and changing narratives about mental health issues. I mean, do you remember years ago? I mean, if you heard that somebody had to go into a psychiatric facility or somebody was suffering from depression, it was a subject that people really didn't want to talk about. You know, it was a shameful subject, in quotes. Of course, it wasn't, but I think a lot of people felt that way. And I think that it is just so important that we actually normalize the discussions about mental health and, of course, sexuality and relationships, because there is so much more that can be done and that we should do during the rest of the year, not just a couple of days of the year, to help people and to give really people permission to seek help when they're finding that they are really spiraling downwards. Because the reality, too, in this country is that access to care and treatment for mental health issues remains out of reach for most people in the United States. And more than one-fifth of the United States adults, 21% or 52.9 million, happen to be diagnosed with a mental health, a bona fide mental health illness in 2020. And interestingly, from 2002 to 2019, the number of adults aged 18 or older with mental health issues increased. And this is a huge, huge increase from 39.8 million to 51.5 million. So we're, really just talking from 2002 to 2019. And that was a nearly 30% increase. And of course, the pandemic, we know, further exacerbated mental health problems for all ages among and including adults aged 18 and older. And in addition, the figures paint a and we really need to not pretend that our kids are okay, because our kids are not doing well. And the statistics really bear this out. For example, there is a growing youth mental health crisis. And I want to cite you some other statistics that from 2009 to 2019, the share of high school students who reported experiencing persistent feelings of sadness or hopelessness increased 41%. And from 2010 to 2020, suicide death rates increased by 62% amongst adolescents. These are kids. These are babies aged 12 to 17. And in early 2021, emergency department visits for suicide attempts were 51% higher for adolescent girls and 4% higher for adolescent boys than in the early 2019. And in October 2021, and I don't want to depress you, but I think we have to really be willing to look at the reality of what is going on in our country. The American Academy of Pediatrics and the American Academy of Child and Adolescent Psychiatry and the Children's Hospital Association declared child and adolescent mental health a national emergency. I mean, really, who would have thought? And we've not yet been able to comprehend the magnitude of the problem and the suffering of millions of people, both young and old. And one of the basic issues that we haven't grappled with is how expensive it is for people to pay for ongoing counseling. And, people might say to me, well, you have a private practice in New York City and in East Hampton, and that is true. And I want people to know that I have always been willing to adjust fees to try to accommodate people as best as I can. And if you're reaching out to a therapist and they are adamant that they are not interested in a payment plan, or they're not interested in even considering making some minor adjustments in your fees, I think that the best advice is for you to exit and find yourself a compassionate, caring, of course, experienced person who really cares more about patients than profit. But it's a real issue. It's a real problem, and we need to be doing a much better job. When I was living in Montreal, of course, for those of you who've been listening to the show for all these years, you know that I am Canadian. Of course, I have dual citizenship so that I'm not going to be deported to Canada. But I began my career in the Montreal school system, and I was a school social worker. We had an amazing arrangement. We had pupil personnel teams where if the teacher saw that a child was really struggling, either academically or emotionally or psychologically, there was a referral made either to the school psychologist, and in some cases, if testing was required, then a referral was made to the school psychologist or perhaps the nurse. And care was very coordinated so that in every single classroom, I mean, we're talking about, hundreds and hundreds and hundreds of schools, elementary schools and junior high schools and high schools in Greater Montreal, there was really a coordinated effort where mental health, of course, school and grades and exams were, of course, important, but were mental health issues were really considered to be a priority. And in this way, I feel that no child was really left behind. And parents were involved. And I remember in the early years when I first started as a school social worker, I would routinely make home visits, which I'm not so sure today, how many therapists, how many school social workers actually do make home visits. And it was important. It was really important to see the environment that the children were living in, and oftentimes there were language barriers, there were challenges, and yet we all really worked, as a team. And the parents, I'm sure initially, may have been a little uncomfortable and a little threatened by school administration people, defining and saying that their children were having some issues. But the team approach, it worked. And a few years after beginning as a school social worker, I became one of the three directors of all of the Greater Montreal schools. And so in every single school, we developed pupil personnel teams, and everybody understood what the deal was. That if we saw that the kids were struggling in any particular way, that referrals were made. It was a coordinated, compassionate, loving effort. And it was something that made a huge difference in the scholastic and as well as the mental health of our students. And I feel, one of the suggestions that I made many years ago is that there should be an Ask Therapist box in every single school. So let's just say that the students were having issues and they were uncomfortable going to a teacher, and somehow they were, not sufficiently noticed by the teacher or other staff at the school, and that they could just, write down a question and they could put their questions in and ask the therapist box. And then I thought it would be a great idea if we had assemblies, maybe not every single week, although that would really be ideal, where the staff, the mental health staff, would be able to answer the children's questions. And in this way, we would be normalizing mental health. We would be making it really okay for the children not only to have issues, but to be able to reach out, and that they would know that there were going to be adults in the school, qualified mental health professionals, who would be available to answer this question. And I think that if we were able to do this, we would see a huge decrease in what is going on in our schools. It's simple, and this actually would not cost a lot of money. And yet I have to say that I have made the suggestion to a few schools since I've been in New York City in the last 12 years. And it's interesting that there's a reluctance, and I'm not exactly sure why there's a reluctance, but there seems to be a reluctance to do something so basic. But the fact is that I think that we do need to be doing a lot more to make mental health, something that we can talk about and that it's okay to talk about. And of course, there then is the access. And, I have a new patient, and he's a 24-year-old young man. And he had made a very serious suicide attempt about 6 months ago, and he was hospitalized for about a month, which is a really long time. So obviously, they felt that he needed a lot of inpatient treatment before being able to be released back to the community. So we were talking about this because I actually just started working with him a couple of weeks ago. And I asked him, so what went on when you were in the hospital? Well, he was given a lot of drugs, and I don't have problems. I don't have problems. On occasion, people are needing medication, whether or not it is for cholesterol, whether it is for migraine headaches. I mean, I think the less the better. But, there are times when you actually do need to be on psychiatric medication. So I was looking at the doses of the medication. He was on a number of different antidepressants, very high doses that had not been changed since his release from the hospital. And then I was asking him about his so-called therapy experiences when he was in the hospital and then when he was discharged. So his therapy was about 20 minutes. It was about 20 minutes a couple of times a week. And I was thinking, 20 minutes, you have got to be kidding. And this is something else that I want to tell you and I want to educate you about, is that if you happen to be someone who's either looking for a therapist or if you are in therapy, I mean, the minimum amount of time has got to be 50 minutes. And in my world, as a Canadian girl, I learned that an hour is 60 minutes. So in my world of psychotherapy sessions, hourly sessions are not 45 minutes, they're not 50 minutes, but they are 60 minutes. So, here's the thing. Here's the thing that we we all have our issues. And the point of the matter is that I think it's really important. And this is why every single week I have my How Are You Doing segment. We know what's going on in the United States now in terms of depression and anxiety and bipolar disorder. We know that the divorce rate for first marriages is 48%. We also know that the divorce rate for second marriages is 67%, and for third marriages, it's 71%. We also know that 3 women continue to be murdered every single day by their so-called intimate partner. So we know, and many people will read about what is going on, in other people's lives. But what is very important, which is why I have my weekly How Are You Doing segment, is for all of us to be very honest with ourselves and to make sure that we are actually on a constructive path. So here we go. So when it comes this week to your mental health, how are you generally doing with your life, with your relationships? We all have sadness. We all feel angry at times. But, if you're finding that your mood on a scale of 1 to 10, and this is something that I ask my patients all the time, is hovering around a 2 or a 3 or a 4, we're talking then about something more than just being sad. And I just want to read you from the DSM, which is the manual, the psychiatric manual that all of us in the mental health field use to diagnose patients. Now, for example, if we're talking about true clinical depression, we're not talking about just, feeling sad on occasion, because we certainly all feel sad on occasion, but we're talking about depressed mood most of the day, nearly every day, okay, for a number of different periods in our lives where that mood doesn't seem to be able to lift, okay? Markedly diminished interest or pleasure in nearly all or almost all activities. Now, there are days that we don't have any interest in anything, and that is normal. But if this persists, if you're finding week in and week out, you have depressed mood most of the day, nearly every day, that you have markedly diminished interest in nearly all or nearly all activities most of the day, this is the time that you need to say to yourself, look, something is off, whether or not you have skeletons in the closet, unfinished business that may be, in fact, the primary reasons why you are suffering, but something, of course, needs to be done. What about significant weight loss or weight gain? Of course, you need to make sure that physically everything is okay, which is why it's also very, very important to not just assume that somebody is dealing with a psychiatric disorder, but to rule out medically, going to see your family doctor and making sure that your depression does not have to do with low red blood count or whether or not you're needing more iron. So this is where the physical and the emotional and the psychological really do need to work together. Another symptom, insomnia, where you're just not able to sleep or where you just really want to sleep all the time. Again, making sure that medically things are okay. Fatigue or loss of energy nearly every single day. As I say again, making sure that this is not a medical issue, but that it's in fact has to do with things that are not going well, that are absolutely not going well in your life or in your relationship. Feeling worthless or having excessive or inappropriate guilt. I see people where they absolutely, when they begin therapy, they feel horrible about themselves or feel very guilty about things that they have done or that they have not done. So again, we all have our moods, but if the moods are persistent and truly getting in the way of your life, in your relationship, it is your responsibility to be good to yourself and try to live your life in ways that are really in your best interest. And that is going to mean reaching out and getting help. Diminished ability to think or concentrate because you are thinking about other things. You may be obsessed about other things that are really, really bothering you. And of course, recurrent thoughts of death, where you have suicidal thoughts, and at worst, of course, people who actually, act out in ways to either hurt themselves or kill themselves. And I think that these kinds of discussions, they're very, very, very important. And ideally, when we're having a bad time, that we have, friends or family support to be able to process what it is that is going on or not going on in our life, or things that are working or not working for us. And this is where the support, if we're lucky, we do have family and friends and community support. And yet I see so many people who have very little of any support at all. Other things to consider here on a weekly basis, of course, is your relationships. You know, how are things working, honestly and truly, in your personal life and in your professional life? And if they're not, what are you planning to do? I know that it's very, very difficult and it's hard to have hard kinds of conversations, but I have a philosophy and I try very, very hard to live with it. And that is, I want zero toxicity in my life in terms of the people who I have in my life. And that doesn't mean that there aren't going to be conflicts. That doesn't mean that we're not going to have problems in the best of our relationships. But my little saying is that a little bit of poison is poison. And if you're finding that you are in poisonous or toxic relationships, even though you might say to yourself, well, he only hits me a couple times a year, or he's only disrespectful to me, on occasion. These are the kinds of things that really, really eat away at us, not just emotionally, but physically as well. So it's about being honest. And I think at times it's very, very difficult to sit back and say, look, the relationships that I thought I wanted so much to work, they're simply not working. And this is where, when people ask me all the time, if we're talking about the world of relationships, what are the most important ingredients that happen to make or break relationships? It's not the bigger, better, in the money. It is emotional communication and problem solving. If we're not able in our relationships, especially in our intimate relationships in our personal lives, to be able to express our hurt, our pain, our disappointment, our anger, and be with someone who is able and willing and cares enough about us to really hear what we are saying. The question really then becomes, what are we doing? What are we doing? So I'm hoping that in your life, your relationships are great and that they are really on track. And if there are things with whether or not it's a boss or a colleague or a lover or an adult child or a friend that you need to address, I hope that you will give yourself permission to do so. Let's talk about substance abuse. Are you concerned? Are you drinking too much? Are you using illicit drugs of any kind? Are you finding if the answer is yes? Are you also seeing that they are getting in the way more and more in your life and your relationships? And of course, this includes over-the-counter medication. I have to tell you a story, and I was just thinking about this right now. I have been treating this 70-year-old woman now for probably 10 years. And this is unusual because I don't usually work with people for 10 years, but there were a lot of issues with this woman. And we went from multiple time a week sessions that I see her now once a week. And she was diagnosed many, many, many years ago before she became a patient of mine with bipolar disorder. So she was given, the usual medication for this kind of a condition. Her psychiatrist prescribed. And what happened over the years is really, really interesting. He continued to increase her dose. He continued to prescribe more and more pills, whether or not we're talking about Valium, whether or not we're talking about anti-anxiety medications. And very, very recently, this woman was hospitalized for actually a number of medical problems. Let's just say that the presenting problem is that she was hospitalized for a series of medical problems, including COVID, and she had infections. And she has been in the hospital now in New York City for about 6 weeks. And although she is still bedridden and we're not able to have our usual hourly sessions, I talk with her very frequently, even if it's for about 10 or 15 minutes, several times a week. And the most interesting conversation that we had was last week. Is that during this 6 week period, now this woman is on or was on so many different kinds of pills, psychiatric kinds of medications. So during this 6 week period, she has been weaned, and she told me was taken off every single, and I would say that she was on probably 6 or 7 different psych medications, which is really, when you think about it, I mean, just unbelievable. So she is now on nothing. And in all the years that I have known this woman, and I know her very, very well, I have never heard her so calm. I have never heard her so clear. And she's kind of amazed. She says, Beatty, she says, I don't quite understand. I'm on nothing. Physically, she's got a lot of challenges ahead of her. That's for sure. But there is a clarity in her thinking, in her speech, in her mood that I have never, ever, ever seen since beginning to treat her over 10 years ago. So what is that really all about? What was it about her doctor and her doctors who were continuing to add more and more and more medications to her regime? The other thing that is so interesting about this case is that typically, not everyone, but people who have been diagnosed with a bipolar disorder are usually given a mood stabilizer. So here we are, 6 weeks out. She has no mood stabilizer, no Valium, no nothing in her system, and she is functioning emotionally and psychologically and psychiatrically better than she has probably in 25 years. So I'm really looking forward when she's out of the hospital to have, more in-depth conversation about this. So why am I telling you this story? Well, I think, again, we have to be very, very careful to have conversations with our doctors who are prescribing medications. And again, I'm not saying that nobody should ever be on medication. I mean, that would be naive. It would be unprofessional. But to make sure that the pills that are being prescribed are in fact the medications that we absolutely need. And of course, the goal, as Dr. Gary Null tells us all the time, is to be able to make a number of lifestyle changes and natural changes in our diet and the way we live, so that we will be able to function very, very well without having to take, bottles and bottles and bottles of medication. I think it's a really interesting, situation with this particular patient. And I was amazed that the medical staff at the hospital, they chose, for a number of reasons, to really detox her. And she is better now than I have ever heard her. So in the how are you doing segment world, if we're looking at our physical health, how is your physical health? Are you absolutely doing what you need to do, which is sleeping, 7 hours a night? I mean, so many people, because of our technology, and of course, different time zones. And I understand there are people who are doing business in different time zones. So there's going to be some, alteration that's necessary. But are you getting enough sleep? And are you eating a good enough diet? And are you exercising? And the whole thing about exercising, I mean, we talk so much about it, but the science studies are so, so clear, how exercise positively affects us emotionally and psychologically and psychiatrically, and of course, physically as well. And, I'm thinking about another patient of mine who has suffered from severe clinical depression for really most of her life. There was a history of early child sexual abuse and domestic violence, and a very, very sad history. And I've been working with her for a couple of years, and one of the things that she's been really reluctant to do is exercise. And so we made a deal. This was about a month ago. I said, look, we're talking over and over again about the fact that you want to lose weight. And so the homework is that she needed to join a gym. So she did. And I speak with her. We have weekly sessions, and she was saying to me, despite the fact that other things in her life have not changed, this is someone. The most important thing that she ever wanted was to have a husband and a family and children. And unfortunately, for a lot of reasons, her particular case, and again, I love her dearly, and I'm not blaming, and I'm not putting any judgment on her, but she spent her life choosing very unavailable and in fact very abusive men. So her happily ever story, at least up to this point, didn't happen. But as far as the exercise goes, and as far as the gym, she was saying to me yesterday, she said, Beatty, you're right. I feel better. My body is starting to, tone up and firm up. And again, the studies are clear what it does to the chemicals in our brain. I know that for me, sports has always been something that's been very important in my life. I mean, I've competed locally and nationally in Canada in a variety of different sports, from figure skating to badminton. And of course, I was number 10 in Canada as a junior. And up until my recent surgery, and I'm hoping to be back on the courts in a couple of months, I've really been playing the best tennis of my life. But I mention that not to brag about my sports life, but the difference that it has made for me emotionally and psychologically. I know that if I'm feeling down, and Jim and I, my husband, we have a treadmill in our apartment in New York, and it's been difficult for me since I had, cervical spinal decompression fusion surgery. This was just 8 weeks ago. And it's been quite an adjustment. And I've had my ups and downs, that is for sure. And yet I will get on the treadmill, and I try to get on the treadmill every single day and go about a mile. And it makes all the difference in the world. I even feel less pain in my neck after I have had a workout. So what I'm saying to you is, we really need to be honest with ourselves. We really need to be savvy, and we really need to have clarity about all of the things that we can do. I mean, there's certain things that we can't do, that we don't have any control over. But these are things that we can and that we should do to improve the quality of our life and our relationship. And homework, of course, I'm a believer in homework for all of my patients. I don't want them to just come once a week and talk. There are things that actually have to be done. There are things that they need to put into action in order to be able to move forward. So my favorite homework that I give my patients is that I ask them every single day, actually multiple times during the day, to pause and to stop and to ask themselves, is this, whatever this is this in my best interest? is it in my best interest to go to the bar and have 2 or 3 drinks? Well, I don't think so. But I want people to have some self-awareness about what it is that we are doing and what it is that we are not doing that is either contributing to the good quality of our life or whether or not we are in a downward self-sabotaging, self-destructive cycle. And I think it's something that we should all do. Maybe not 5 times a day, but to just ask ourselves, are we living our life in ways that are really in our best interest, whether we're talking about our mental health, whether we're talking about our relationship, whether we're talking about drugs that we may be taking, or whether we're talking about lifestyle issues. Because the fact is this, that it is our avoidance and our denial and our blame and self-blame and making all kinds of excuses and our defensiveness that keeps us in a downward cycle. Because the fact is, and I know that this is not easy, that it takes a lot of courage, a lot, to be willing to, in the honest moments of our days and nights, to be willing to acknowledge and address and resolve as best as we can, even though we can't change history, the things that continue to get in the way of our life and our relationships. But you see, the consequences of not doing this are not good, because if we refuse to step up to the plate, and confront our demons, the old demons that we can't change, but there is a way to emotionally process what did and didn't happen in our lives that contributed to our being in a bad, dark place. And as I say, there is a way therapeutically to do this, and to do this very, very successfully. Because unless we're prepared to do this, the consequence to us is that it becomes very, very difficult to be able to live a good life. And this is why every single week I go through this "How are you doing?" segment. And I'm hoping, as you're all listening to the show right now, that you're thinking about all the different areas that I have mentioned, and that you are going to be willing, you don't have to do everything, to begin to maybe prioritize and tackle some of the things that will definitely improve the quality of your life and your relationship. Well, in the New York Times a couple of days ago, I was reading an article about the happiest countries in the world. I don't know whether you follow any of this, but for 8 years in a row now, guess what country is the happiest country in the world? Well, it is certainly not the United States. In fact, the United States ranks only 24. So the happiest country in the world happens to be Finland. So I was reading about all of this. So what is it that is going on in Finland that ranks them right at the top? So there's a distinction here. They talk about affective happiness, like mood happiness, fun and sex and laughter and parties. And then they also talk about evaluative happiness. And what evaluative happiness deals with is things like good health and sufficient income and social cohesion and safety. Okay, so the difference between the affective, the feeling happiness, and the evaluative happiness. And so I'm thinking, what is it? What is it that is going on? Well, interestingly, and I didn't know this actually until this morning, that in Finland, they have saunas. Yes, saunas in every single building in the country. And when I was reading about this, the saunas are there not to sweat out the toxins as they are, or as we think about saunas in the United States. But this is what they say, that sitting in the nude serenity amongst family and friends and even strangers, it helps to bring people together. Again, it's connection, it's relationships, it's safe in the bone, deep sense of trust that people get together, strangers get together, and friends as well. So that imagine in a country where every single building has a sauna. I thought that that was really, really, really interesting. And also in Finland, they talk about things like long life expectations in actually in all of the Nordic countries, highly distributive tax regimes, functional governance, low corruption, shared norms. And I was reading something that there's no garbage on the street, and that people actually, and this was a writer from the New York Times who actually spent some time in Finland, that people actually, they don't cross the street if there is a red light, even if there's no traffic, so that there's a certain kind of an order that really seems to contribute, big time to happiness. And with the happiness research that's being done, apparently uh, there are 1,000 people in every single country in the world, and this is a Gallup poll research study, okay? And they are asked, I don't know how these 1,000 people are chosen, but it is 1,000 people in every single country. And that the total sample apparently then becomes 3,000. So I'm not a scientist, so I can't exactly explain the sample. But what the way it works is that people are asked to rate their life on a scale of 0 to 10. And they're asked which step. So there is a 0 step, and then there is a 10 step, and they are asked to rate their life on which step of the ladder would you say that you personally feel at this time. So it's from 0 to 10. So again, we have Finland at the top. We have the United States ranked 24. The Nordic countries consistently are ranked the highest. And the top, people may want to know, so what are the top countries that rate happiness? Denmark, of course, Finland is at the top. Then we have Denmark and Iceland and Sweden and Finland and Norway. And they talk about the most miserable countries where people are feeling the most miserable: Afghanistan, Yemen, Haiti, and the Democratic Republic of the Congo. So, what is the takeaway for us? Well, again, highly distributive tax regimes, functional governance, low corruptions, shared norms. I mean, wouldn't it be amazing? And I don't know whether you would do it or not, if there was a sauna in every single building here in the United States. What a great way to be able to connect with other people. And of course, it's the connection, it is the socialization, it is the relationship that really and truly does protect us. Also in the New York Times, in the magazine section of the New York Times this weekend, uh, psychiatrist, and I've actually cited many of his research findings. Psychiatrist Robert Waldinger. This was in 2003. He accepted a new job at Harvard, where he had long been affiliated, overseeing one of its most prized research projects. So, Dr. Waldinger is a psychoanalyst by training who would later be ordained as a Zen Buddhist priest, and he'd always been preoccupied by questions with an existential kind of a flavor, which is why when the university asked him to take on the longest running wellness study in American history, he readily agreed. And I was reading the article. The article, it's a very, very long article. And these are some of the things that were discovered. Waldinger knew that being married was associated with overall well-being, but he was intrigued by other more recent studies that found that marriage alone wasn't enough. What really mattered, and I know that you're not going to be surprised to hear this at all, what really mattered was how happy the marriage was. It wasn't enough to be married. It was about the quality and the happiness of the marriage. So what he did, he followed 47 octogenarian couples from the study over an 8-day period, noting how much time each person spent with their spouse and with friends and family. And he found that for those in happy marriages, socializing with others in their circle contributed to the couple's happiness. And if they were in pain or ill health, however, and this is something I completely relate to, that if they were in pain or in ill health, however, it was only spending time with their spouse that seemed to protect them from the mood dampening effects of physical suffering. And other research that he conducted found that the people who scored highest, because I always like to look not just at the doom and gloom of what's not working, but we also need to find out and figure out, what are people doing who are really living happy and healthy lives. So the other research he conducted found that the people who scored highest on measures of attachment, closeness to their spouses, were also the ones who reported the highest levels of happiness, which is why it is so, so, so important that we choose people who are really good for us, which is what my research, what my books are really all about, how to never make a mistake in love again. Because if you look at the statistics, the divorce rate statistics, which I cite every single week, I mean, they're really very, very depressing. 48% divorce rate for first marriages, 67% divorce rate for second, 71%. This is why it's so, so, so important that we're very careful, very attuned to who we are going to let into our life, which is why, of course, I did my research. And my research was 450 people in the Boston, Providence, and conducted area. It culminated with me developing my 10-step formula that teaches all of us how to assess, how to evaluate who is good for us and who is not good for us before committing to any serious relationship. And I know the idea of assessment is not sexy and it's not lovey-dovey. And yet it is critical. When you think about it, we've never had as many books about relationships and therapists and love coaches and life coaches. And yet what we're seeing that there is a downward spiral when it comes to people being able to find and maintain and sustain healthy relationships. So Waldinger's findings, I mean, they're very consistent with everything that I have always, believed. And there's one takeaway because people are always interviewing Dr. Waldinger. And what he is saying, and this is a quote, that the clearest message that we get from a 75-year study is this. And there's really one thing. The good relationships keep us happier and healthier, period. That Dr. Waldinger said in a TED talk that he gave in 2015. And of course, nothing has changed. That strong, long-term relationships with spouses, family, and friends built on deep trust, not achievement. We're not talking about fame or fortune, right? On trust and on love were what predicted well-being in our lives. And Dr. Waldinger, he had worried that his big reveal was so intuitive that he would be laughed at off stage when he talked about this. Instead, the talk is one of TED Talk's most watched to date with more than 40 million views. So it's love, it's connection, it's not bigger, better, more, and fame and fortune. And again, for all of this to happen, we need to be in a good place. We need to have clarity about the ingredients that go into healthy relationships, whether we're talking about love relationships or friend relationships. And we need to be willing. We need to be willing to do an actual assessment process. I've said this to you many times that before I did my work, I think I was the most spontaneous person around. I'd say I met a lovely person. I met someone who's wonderful. I would never, ever, ever say anything like that. The best we can say in meeting somebody initially is that the person appears to be wonderful and nice. And my research found that it takes about a year using my formula to really find out who somebody is and is not. Well, I want to talk more next week about Dr. Waldinger and the happiness studies, but in the meantime, it is 3:57. I have no idea where the time went today. And I want to thank you all for listening and tuning in as you have for the last really 12 going on 13 years. I really appreciate your being here. And I have to say, I really, really appreciate the producers at the Progressive Radio Network. Dylan, you're absolutely amazing and wonderful. And Jim and I thank you. We thank you all the time for always being there for us and making sure that our shows run flawlessly. And I want to leave you with my 2 weekly messages. One is to make sure that you're doing everything that you could possibly do for yourself. It's not selfish to be living your life in ways that are in your best interest. And secondly, of course, in this world, in this crazy world of ours right now, we need to do a much, much, much better job in learning to connect with others, respect each other, listen to others, even though we may disagree with them. The art of conversation is really, really important. And in that way, we're going to feel better within our own lives, and we're going to help to create a better life and a better world for others. So have a very, very, very good rest of the day. And I will talk with you next Monday and every Monday from 3 to 4 Eastern Standard Time. And be well. We'll talk later. Bye-bye.